Moving on now, 1,000 orphans across Ruiru District benefited from a liaison between two youth initiatives. The Focus Project and Lucas Foundation provided 1,000 scholastic backpacks and promised to maintain the supply for the chosen orphans throughout the year in a bid to meet the gap left by government's free primary education. Our reporter Antonin Anyango has more details on that following story.
Despite the government's effort to curb the level of illiteracy in the country by introducing free primary education, the unmet need of child education in the society is still wide, with many orphans and other vulnerable children's basic need unattended to. Lucas Foundation and Focus Project stepped in to meet such a gap in Ruiru District with scholastic backpack aid.
So today is a day that concerns mostly the orphans. We have 1,000 orphans chosen to be supported with the scholastic material backpacks that are supposed to help them and ease their challenges in school so that they can get some of the services they need educationally.
Over 1,000 students benefited from a liaison between American Lucas Foundation and Focus Project in Kenya after they were invited from 100 schools within Ruiru District. From a distance, one cannot tell what they are going through. But with free primary education, without proper basic needs, their education system is not complete.
So we are adding value. We are adding value to what the free primary education is giving, and we thought, okay, if they give 2 books, we can also add 2 books. Yeah. If they give 1 pen, which I doubt if it's given, we can also give another pen, and now add a bag that they can be able to carry.
The gap left for parents and guardians to over 1 million children is still dire. Lucas Foundation, started by American Pastor Scott, promised to keep the supplies of stationery for 1,000 students throughout the year. Named after a Kenyan boy adopted by American couple, Lucas Foundation has been providing educational support to many orphans in the country since 2009, with an aim to supplement the government program of free primary education that the society feels is not complete.
We adopted a little boy named Lucas and fell in love with him. And as we went through the adoption process, we realized the extreme poverty that many of these children live with. And we had to make a difference. We could not stop. And we realized education is the key. Education is hope, and it is a future for Kenyan children. And we want those children to have a future.
Through their respective primary school teachers, Focus Foundation ensure fair distribution of aid given to the identified orphans and facilitate their stay in school. Mary Nyambura, a Class 8 student who has gone through her education in the hands of these two organizations, tells of how her life has been changed.
We learn about what we need. They give us what we require, like mostly when it comes to the terms of education. For our homes needs, they have built houses. They have made us look smart. We have been like the other children, even if we are orphans.
Last year, Lucas Foundation supported over 500 children through their primary education by providing for their accommodation, food and paid school fee for some who went to private schools. Antonin Anyango, GBS News.
As we grow, each has a dream of how they would like to live their lives. But life frustrations shadows many hopes and turns life all around from our expectations.
When I was in school, nikapata mimba hapo. Kurudi nyumbani wazazi wakakuwa love, nikafukuzwa. Jamaa mwenyewe akanichukua nyumbani, nikakaa naye from Takaniambia you are west. Sasa nikatoka nikakuja town kwa auntie. Na huyo auntie akanifanya kama maid, nikafanya kazi mzuri. Kafika mahali tunakosana naye. Sasa ikanibidi nitoke. Kutoka nikaingia kwa nyumba ka 200 shillings. Kutafuta barua kwa hoteli sikupata. From then nikaamua kazi ya street juu sasa pale nikiingia naweza kula.
Nilianza hii kazi ya kwenda kwa barabara the year 2008 after bwana yangu kupass.
Nile tu kwenda kubahatisha juu hatuna otherwise na una kazi ya kufanya. Unaona kabla tu ulale njaa na tu unafumilia tu.
Deaths, abandonments, peer pressure are some of the potholes that landed a group of ladies that GBS caught up with in Ruiru town into unlawful business dubbed Biashara ya Rodi. Jane, which is not her real name, got into the mess after she became pregnant at a tender age. To her family, it was a big letdown.
Unajua mtu akiwa kwao kupata mtoto wazazi wengi huchukia mtu. Sasa mimi nilikuwa nimeolewa, mzee wangu akakufa, nikarudi kwetu nikaika kazi. Sasa hizo wazazi wangu wananielash, yani sky poa. Nikaona tu niende nikachukua nyumba nikakomboa nyumba, hiyo business ndio kulipa nyumba wa mtoto. Mimi nikawa na shida sana. Nikajiona nikiwa huko.
She has been in the business since 2008, trying to bring meaning top her life. But to this day, has she really found it?
Lakini sisi wenyewe tunachukiwa, watu wanatudharau, hatufurahi wenyewe.
Failed marriages have also led many young mothers into this business that many think is just but a shadow. For one lady who we named Judy, she was enjoined in the business after she realized her husband was unfaithful.
Kwa shida hapa na pale hivi, unajua siku hizi wanaume wamekuwa kitu kingine. Nikampata na mtu mwingine, unaona, nikaona siwezi endelea na yeye, na kulingana ile mateso alikuwa ananitesa nayo, nikaona siwezi endelea.
The death of her loved one led Lillian, not her real name, to the streets of Nairobi, where she also joined biashara ya rodi.
Nilianza hii kazi ya kwenda kwa barabara the year 2008 after bwana yangu kupass. Alikuwa mwizi, alipigwa risasi Ruiru. Sasa nikaanza hiyo job juu after kupass nilienda nikapata mabishi yangu wanafanyanga hiyo kazi, nikaendelea.
The business name, biashara ya rodi. The businessmen, wana rodi. It really doesn't matter what prompted these young girls to venture into this business. What matters is they have expressed hope that one day very soon they will quit and do something else different.
Kazi nitaiwacha. Juu kazi yenyewe inatuchokesha. Sometimes unastapasa customer kama 5, utoke kama umechoka, saa zingine huna nguvu. Itanibidi niwaje, juu sasa sitaifanya forever.
Natafuta. Sina kwambia imenichokesha. Sasa yenyewe nilikuwa nafanya ilikuwa na pesa. Lakini sasa hizi polisi haina doa hata.
Yenyewe tukipata kazi nyingine tunaweza fanya kwa sababu hatufurahi kufanya hii kazi.
Since charity begins at home, it's up to parents to ensure that they least know the kind of jobs their children do in towns and advise accordingly. It is not surprising to hear that many parents can't even tell where their own children stay.
I would encourage parents, in particular parents, and especially for those who have a girl child, to talk to their girls. And even if you hear a girl is working in town, you need to know what are they doing really. Because I don't think there's any commercial sex worker who can openly tell their parents that I'm doing this business.
But thanks to Ruiru Baptist Church, which immobilized over 60 ladies in the same business, and through charity have changed their lives positively, and now many lives have been spared from the killer AIDS disease.
We also make sure we supply them with condoms to reduce infections, especially for sex workers. Condom is key. Not just giving them condom, but also training them on how to use condoms so that they don't get infected.
As fingers may be pointed unto them, it is the duty of the whole nation and society to ensure that safety, love and care, and most important, food is provided to all, to avert attempts to make ends meet on the streets in risky and illegal businesses such as biashara ya rodi. There is worry that the issue of sex workers might never be addressed in totality in the country. But if such community projects and NGOs were put up, then there will be hope that these issues will be addressed. Faith McKenna, GBS News. Are the effects of teenage pregnancies being addressed with sufficient vigor in Kenya? With statistics indicating that 31% of school dropouts among girls is as a result of pregnancies, this is a question that begs asking.
I don't think they are being addressed. Because when you talk about the numbers of unplanned pregnancy in Kenya, there are so many. And I don't think there's a lot of government is doing enough in terms of changing the situation. I don't think it's a lot of organizations that are addressing such issues. So even if they are there, more needs to be done.
Ruiru Sub-District Hospital records the highest number of teenage pregnancies in the area. It is against this backdrop that Focus Youth Initiative came up with a project that will focus on the issue, hoping to reduce the number of early teenage pregnancies in the area.
We noted that a lot of young girls, as young as 8, are pregnant. And we thought, based on the experience that we have, we could do something, especially on reducing the chances of these girls getting the second and third pregnancy.
If the young women are giving birth, what can we do? What can we do? We need to bring them in. Some of them are not stable, and most of them are not stable. What can we do for them to be stable?
This community-based project describes the socio-economic determinants of teenage pregnancy, experiences of health problems during pregnancy, and healthcare utilization patterns among adolescents aged between 12 to 19 years old.
The biggest percentage of people who report for antenatal clinic are young women. And we're talking of 24 years and below. The biggest percentage, even from our data, we find that the biggest percentage are 24 years and below. Those are the ones who are pregnant.
During their visits to health facilities, Focus Youth Initiative uses short skits, songs and recitations to deliver their message, which is usually focused on pregnancies as well as HIV.
Hongera kwa kuniweza. Baby nakupenda. Sio eti nakutenda. Lakini baby.
Lakini nini?
Nililewa.
Ukalewa.
Nikapewa.
Ukapewa.
Nikatenda.
For the girls whose pregnancies do not have a dramatic timing, their fates remain unknown because they conceive and give birth away from the gaze of the public eye. Yet, the sexual exploitation of underage girls is at epidemic levels in our society.
Those small ones, they are being misused by their relatives, fathers, uncles, cousins. Somebody who is close to them, they rape them. And then they tell them not to tell. If they tell, they will die. They cheat them. And that is common here in Ruiru.
But when should our children be taught about sex education?
As young as in primary school, sex education is an important aspect, it's an important education for the young kids in primary school.
As long as they can understand, it's good to teach them that it's not good for any man to touch their private parts. But at 8 years, now we can hit the nail at the top.
For minimal chances of early pregnancies, the girl child has to be instilled with values at an early age so that they will have high self-esteem as they grow up.
The parents also need to talk to their girls, and the community as a whole need to talk to their girls in terms of raising their values, such that if they have values, the strong values they have, the chances of them getting an unplanned pregnancy or early pregnancy will be minimal. The cases will be low.
While addressing the issue of sex education, parents can't escape blame either. They should be in a position to advise their children on this topic.
The parents, they are the ones to blame because they're shy, they don't tell their children how they should behave. They think if they start using pills, it's a way of telling them to continue playing sex.
To avoid the effects of ignorance from our young generation, families and schools should take the subject on to teach and educate the children to avoid the repercussions, not forgetting that prevention is better than cure. Faith McKenna, GBS News.